Hello, this is Dr. Gay from First Look MRI, and this is a 65-year-old female who has complaints of anterior knee pain. She'd had her kneecap injured in the past in a patellar tendon repair, and it looks like she has re-torn this. This is just a straightforward, simple case here of a patellar tendon rupture. So this is the kneecap in the front. This is the femur, tibia. We see the anterior cruciate ligament, the ACL coming down here. And then in the front again we have the kneecap that doesn't look quite normal. Normally it should be really bright like the other bones, but instead it's patchy, has marrow edema within it. The quadriceps tendon, all the thigh muscles attached to this, and it comes down here to the top. It looks pretty good. Maybe one of these little strands is torn here from the very front, but really it looks good otherwise. And the problem, as you can see, is down here. The patellar tendon is thick, which is normal for prior surgery. It looks like it's normal down here to the tibia, but as it comes up, we see it ends right there, and there's a fluid-filled gap, and then here's the bone. So it should attach to this bone. It's completely torn from that bone and pulled down. You can see this hemorrhage or fluid here, and the patella looks really strange. Some marrow edema all throughout the kneecap. So a complete re-tear, ruptured patellar tendon is peeled away from the bone. And this patient had one other finding. If we go over here to the medial side, these are part of the thigh muscles, the quadriceps, or the quads rather, and this is called the Vastus medialis muscle, and the fibers come like this down. Now we can see there's a problem. These fibers come down here and they end, and we have this vertical tear like a rip through paper. We have the muscle is torn and fluid or hemorrhage is there at the site of tear. The muscle is also too bright. Muscle should be darker than this, like more like this down low here in the calf. So this is edema throughout this vastus medialis muscle, and this longitudinal tear right through the muscle. This is a different orientation where we see the kneecap in the front here. It's too bright. This is the femur, and the medial side is here. We're going to look at that vastus medialis muscle tear. And right here we see it. So we have white fluid between the muscle. Here's the muscle, and here's this rip right through it, and this fluid-filled gap at that longitudinal muscle tear. So this is definitely not helping anything. So a re-tear of the patellar tendon, and also a tear of that muscle belly there. Thank you so much.